So, one of the reasons that I took on the specialty of extremities and specifically ankles, knees, and hip problems, I see this all the time where people come in with a lower back issue, a hip issue, and it's really not where their pain is because how often is it that it's in the exact spot and it's just, you gotta keep poking it. That doesn't always work, right? Most people are sitting there stretching their hamstrings and calves all day, and it just keeps getting tighter and tighter. A lot of issues. We're on our feet all day, and most people aren't wearing proper shoes. Most people don't have proper foot support. They have really weak muscles, and sometimes they need an extra bit of help, which is why I really love the foot levelers. I see a lot of people buying the Dr. Scholl's inserts, or they get these hard plastic ones from their podiatrist, which are not cheap by any means, and I haven't found them to be very effective at all. One of the things that you need is you have to have some flexibility in your foot, and that's where we do the adjusting. But then if you need some support, these are really great because they actually support different parts of the foot in the right spots. We will do a custom scan. They send them out to a company that we have contracted with who makes these really great quality orthotics. I've been wearing mine for about 3 years. I love them. And one of the things that makes it different is a lot of people will get these orthotics that are extremely hard in this medial arch part, and they just roll their whole foot to the outside, and they don't realize you actually have 3 arches. You have one in the middle here, one on this side, and then one going across right here. So these actually correct all 3 of those at the same time while letting your foot move appropriately, because we have to have good ankle motion. If you don't, you tend to get more knee problems, more hip problems.
So I have an orthotic here, love it. You know, I'm been doing so many different specialties. I've never really done orthotic. I got these 15 years ago. Dr. Quinn was able to go through and get me my new ones finally. Mm-hmm. You know, after 10 years, your feet change a lot. So I'm doing a lot better with my sassy. Sometimes I'm teaching classes on emotional EQ, basically, instead of IQ, and I'll be standing there for 14 hours, and to have something that you can slip into your dress shoes and actually trim, you know, that's one of the big things. I tried some other stuff like he was saying earlier today about just being too stiff. I just love this. So really, this is just me coming as a patient using the product. 10 years is it's like your mattress. I mean, it's an investment, and we're taking 5, 6, I don't know how many steps a day, a lot. Mm-hmm. So it's been really nice. Thanks, man.
Yeah. Everybody needs different amounts of support too. So there's the foot scanner will actually take a 3D measurement of how high or how low your arch is, and then it will custom make a support that is specific for what you need. Not everybody needs them, but I find that a lot of people, if you're on your feet all day, if you have a high activity job, if you're an athlete, a little bit of support can really change your whole body as well.